If you've been told you have a bulging disc at L4-5, L5-S1, there's a very good chance surgery is not the first step you actually need. And in many cases, rushing into surgery can be a big mistake. Most disc bulges, they don't improve because of surgery. They improve because inflammation is managed correctly and the spine is given the right conditions to recover. In this video, I'm going to explain why many disc bulges respond to conservative treatment, what actually helps recover, and what slows it down. And then there's some clear red flags that I'll tell you about that will help you know when surgery is necessary. Make sure you stay to the very end because understanding this difference can completely change how you make decisions about your spine and the disc injury recovery process. Hi, I am Dr. Chris Cameron. I'm a chiropractor right here in Lucan, Ontario. I help people with degenerative spinal conditions like back pain, neck pain, disc bulges, disc herniations, and sciatica. I help them to overcome their pain, improve their health, and get back to doing the things they love, all through safe, non-surgical corrective methods. On this channel, you'll find practical tips and insights on managing back and neck pain, healing disc injuries, and improving overall spinal health. Before we go and dive in, make sure you hit the subscribe button so you don't miss any new videos on how to strengthen your spine, improve your well-being, and live a more active, fulfilling life. I upload a new video each and every week. Most people assume that a bulging disc automatically leads to surgery, but that belief is one of the biggest misconceptions in disc injuries. In reality, upwards of 90% of people with bulging discs or even herniated discs, they never need surgery at all. And the reason is actually pretty darn simple. In many cases, the body, it is capable of healing itself when symptoms are managed with the right conservative, non-surgical treatments. Pain and nerve irritation often improve over time, not because the disc was removed or cut away, but because inflammation settles and normal function returns. Once you understand how the healing process actually works, the fear around a disc diagnosis, it starts to change, which naturally leads us to the next question. How does the body actually reduce a disc bulge in the first place? One reason a bulging disc does not always require surgery is the body's ability, in certain cases, to reduce or resorb the disc material through a process called resorption. When the inner portion of the disc, called the nucleus pulposus, moves outside of its normal and proper position, the immune system may recognize this as a foreign tissue. When this happens, it can trigger an inflammatory response. Now, that inflammation isn't always a bad thing. Immune cells, including macrophages, are drawn to the area and begin breaking down and clearing up the displaced disc material. As this process unfolds, pressure on nearby nerves can decrease, and the symptoms, they gradually improve. Research shows that meaningful disc resorption can occur over a period of 3 to 6 months. But here's the key part. This process depends heavily on the conditions around the spine. Early improvement often means resorption is underway, but when pain continues beyond 3 months with little change, relying on this alone, it becomes risky. And if symptoms stretch beyond the 6-month window, inflammation can shift into a chronic state. Scar tissue may begin to form and stabilizes the injury, which often slows recovery and makes healing much, much more difficult. And that's exactly why timely, structured, conservative care matters so much before disc pain becomes chronic. And that brings us to the next piece of the puzzle. Even though the body may be capable of reducing disc material, ongoing mechanical stress on the spine can interfere with that healing process. This is where conservative care really, really matters. Problem areas like the L4-5 and L5S1 are under constant stress from posture, movement patterns, and how load is transferred through the spine. If those stresses aren't corrected, inflammation continues, even if the disc is trying to heal. Effective conservative care focuses on improving spinal mechanics and restoring controlled movement, correcting spinal misalignments, and reducing repeated strain on the injured disc. Targeted exercises and specific stretches help rebuild strength and coordination so the spine can tolerate everyday activities without constantly flaring up these symptoms. This is very different from random exercises or a complete rest, both of which often delay the progress. Pain might temporarily improve with injections or medication, but medication does not correct the underlying cause of the disc injury. Long-term improvements come from reducing mechanical irritation and improving how the spine functions. And when that foundation is in place, recovery becomes far more predictable. This is exactly why we use a structured, multimodal, non-surgical system in our practice. We call it the Back Strong Protocol. It's an 8-step approach designed specifically for disc bulges and disc herniations. Using this system, 78% of the lumbar disc herniation patients have reported a 50% improvement within 3 to 6 months of care. Stay with me, because at the end of this video, I'll show you where you can learn the Back Strong Protocol in great detail, because a multimodal approach is often the missing link between chronic problems and real recovery. One of the most confusing parts of a disc injury is that people often feel better even when their imaging still shows a bulge disc. And that's because pain is not always driven by the size of the disc bulge. In many cases, symptoms come from inflammation and nerve sensitivity, rather than the ongoing structural damage. As inflammation settles and the nervous system becomes less reactive to pain, pain levels drop and function returns. Over time, nerves tolerate normal movement again, muscles regain coordination, and daily activity stops triggering constant irritation. This is why so many people have disc bulges on an MRI, but no pain at all. Recovery isn't measured by whether the scan looks good. It's measured by how you move, how you feel, and what you can get back to doing again. Understanding this shift is crucially important because it helps people focus on progress instead of fear. Even though most bulging disc cases improve with conservative care, surgery does have an important role in specific situations. Surgery becomes a consideration when the pain is severe and unrelenting, or when symptoms continue to worsen despite a structured course of non-surgical treatment. Surgery is also appropriate when there are signs of progressive nerve damage, such as increasing leg weakness, loss of coordination, numbness in the buttocks or groin area, sometimes called saddle paresthesia, or changes in the bladder or bowel control. These symptoms can be warning signs of a rare but serious condition called cauda equina syndrome. If any of those symptoms are present, it requires an immediate visit to the emergency room and may require surgical decompression. While cauda equina syndrome is uncommon, knowing these red flags is critical. I hope this video gave you clarity about a bulging disc and its recovery process and helped you reduce some of the fear that often comes with a diagnosis. Except in rare circumstances, spinal surgery is not the first option for treating an L4-5, L5S1 disc bulge. In many cases, a disc injury can improve on its own. And when it doesn't, there are proven non-surgical conservative care options that can support healing and speed up recovery. If you found value in this video, please like it and share it so more people can make informed decisions instead of rushing into unnecessary procedures. If you have a question about a disc bulge recovery process, go ahead and drop it down in the comments below. I read and answer all of them. And be sure to subscribe if you want more videos on how to strengthen your spine, improve your well-being, and live a more active, fulfilling lifestyle. As promised earlier, here's the video on my channel where I outline the 8 steps on the Backstrom protocol in great detail. Go ahead and watch that now.